Hi, I'm Dr. Miriam Smith, DNP, and I'm the host for Empowering New Nurses. Now, today we'll talk a little on the foley, on the catheterization, urinary catheterization, actually. So this is a continuation of um, the foley or the urinary catheterization. And why I'm continuing is because, yes, the last episode we talked about what? The insertion of the catheter. Now we're going to be talking little on the maintenance of it. Okay, the catheter is there. My young nurse, the catheter is already there. And so we have to, what do we do to ensure that we don't cause any infection? To make sure we secure it. We secure it on the patient, definitely. When it close, we ensure a closed system, and we're going to make sure that there's no obstruction or twisting in the tubing. We're going to keep the collection bag below the level of the part of the bladder. Because if we should have it higher, then there's going to be a backflow. That definitely would cause infection. Routine hygiene and cleaning is very important to make the meatus surface during bathing and at different time schedule for that to prevent any further infection. You're going to leave the Foley catheter in until it's needed to be out. Or you're going to, as I said earlier in my earlier episode, that you're going to ensure as a prudent nurse and a nurse who's advocating for the patient, and you know that if it's there too long, what can happen? So your goal is as soon as it's not needed, there should be a voice or some recommendation if the doctor is not aware. So you're going to give that information that says that there is no need for it. And of course, it's a team effort. You know, if there's no need for the catheter to be there, then it should be removed. And when it's removed, it should be documented. So document. It's always important to do that. Well, those are the few tidbits on ensuring that it's maintained, the catholic catheter or the urinary catheter is maintained. And just a reminder that CAUTI or catheter-associated urinary tract infection, this can happen whether it's from the bladder, this can happen in any of these organs, whether it's the bladder, the urethra, the kidney, those areas can be affected. So it's important that we, of course, as long as the patient, there's no a reason for the patient not to receive fluid and all of that, it's important to make sure you're going to be measuring, indicating the color, all of that stuff that you know that's supposed to be documented. And the easy thing about it now is that you have like a checklist, as you do your intake and output, and as the PCA puts that in and so forth. And as you observe, you realize also that it's critically important what you take in, how much in and how much out, to see how the process is and the recovery period. So we don't want to cause any infection. We want that patient to be safe. Patient goes in without being harmed and has enough situations there already. If it's you don't want to harm the patient when the patients come in. So we're going to do our best to make sure that safety and the health of the patient is maintained. Thank you. I'm Dr. Miriam Smith, Empowering New Nurses show. I'm excited again that you came today, and you're going to say to someone else, encourage someone else, another young nurse, another nurse who needs to be reminded that's okay. It's okay. It's better safe than sorry. So remember, you're going to check your policy and procedures, because one sock doesn't fit everybody. So every hospital, they have their own policy. However, this is a common denominator. Wash your hands prior to, before, and after. You're going to maintain your sterile technique throughout. And of course, the maintenance, you're going to make sure, and you have a right to educate others. If you see someone holding the urinary bag above the patient's bladder, that's a no-no. Whether it's any of the associates, it doesn't matter who. We have that right to advocate for our patients, to prevent CAUTI, to prevent catheter associated urinary tract infection. Thank you so much. Thank you. You can contact me on YouTube at Miriam Amanda Smith. You can contact me on Instagram, Miriam Smith, on podcast, Empowering You Nurses show, and of course, Facebook, Twitter. Not Twitter. You can Facebook, Instagram. Thank you. Thank you. Thank you.